Hi, Dave Cook here with Safeguard Insurance, and today I want to talk to you about your Medicare options and the different parts of the plans. Pretty much there's 4 different sections, and that is Part A, Part B, Part C, and Part D. And a lot of times people get confused with the different portions of the plans, but it's pretty simple when you break it down. Your Part A is your hospital insurance, and that's going to cover, like when you go into the hospital and you're admitted into a facility like that, it's also going to cover your skilled nursing facilities, and also like your hospice care, and maybe, I think I may have mentioned your home health care. But then your Part B is your medical insurance, and typically with this is you're going to pay for that portion of the plan. For the 2013, the premium for that, which will come out of your Social Security or depending on how you're paying for that, would be $104.90. Now this covers things like your doctors, your specialists, and other healthcare providers. It also covers outpatient care, home health care, your durable medical equipment, and some other preventative services. Now the thing is I want you to remember is through this process, if you do not have creditable healthcare coverage and you do not take Part B when it's first available to you, you could receive a 10% penalty from the government for every year that you do not take that. So please make sure that that's something on your radar and that it is a penalty if you do not have credible coverage and you do not take that option. Your other option within this plan or the Medicare system and your options is Part C. Now this usually includes like your Medicare Advantage plans. You have HMOs, PPOs, special need plans, all these different plans within the privatized insurance. Now these companies are approved through the government to be able to provide health care for you, and what you want to do is make sure that if you do look at a Medicare Advantage plan, that is the best option for you. With your Part A and B, you're able to see pretty much any doctor across America that accepts Medicare. Now within your Advantage plans, you are either going to have a primary care physician or you're going to have a network of doctors and hospitals. So this is something that could be very important to you if you want, to manage your care versus having someone else kind of help you with that care. Now also with the Medicare Advantage plans, you're going to have things like co-payments. You're going to have your maximum out-of-pocket, which is like your deductibles for a calendar year. So you're going to have to hit that with a maximum amount of pocket. Now remember that a lot of these things with the co-payments and your maximum amount of pockets, it could vary. So just depending on where you are financially, it could make a major difference. But the one nice thing about the Medicare Advantage plans is that not only do they have to include everything in Part A and B, but there is usually the co-payments for that. But they're going to include most of the time a prescription drug plan and also other services such as like your basic dental, your hearing, your vision, and maybe even a gym membership. So that's something to consider if that's important to you, and it's all inclusive within those plans. So with that, your only other option that if you do take original Medicare Part A and B, you are going to have to look at a prescription drug plan. And those prescription drug plans, once again, are approved through the government. It's privatized insurance companies, and they're going to have different costs, and they're going to have different costs of prescription drugs within their formularies. So when going through, work with an independent insurance agent. And I can't stress that enough. If you work with an independent insurance agent, they're going to make sure that the plan and your prescription drugs and whatever your needs are financially, healthcare-wise, that it's going to suit you. So with that pretty much wraps up your Medicare options for today. And hopefully you got some good information from this. And if you have any questions, just give us a call. We'd be more than happy to talk to you, no obligation, and help you through this process. So with that, make it a great day, and we'll talk to you soon. Bye-bye.